Hello, friends, and welcome to the Disorder Channel's Once Upon a Gene TV. I'm Effie Parks. Today on the show, we're going to dig into how we can become better communicators and more organized advocates. Most of us have little to no experience with the medical system before rare disease. It's one of those things that we're thrust into, and we got to learn quickly. Sometimes I still feel so lost that I throw in the towel for a while, and then I seek advice from parents who are older and wiser, or just further along in their journey. And I do know two dads who are much older, clearly older, and undoubtedly wiser. My two pals, Daniel DeFabio and Bo Bigelow. Hey guys.
We're ancient, huh?
At least older, if not wiser. Yeah.
One of the two.
Oh boy.
Good to see you guys again.
Yeah, great to see you. I think we've all been paying attention to the new hashtag rare disease truth. You guys seen? If anybody hasn't, they should search for it on Twitter. But have you guys picked any favorites from there? I found so many of them to be just surprising and compelling and moving.
Yes, Nina Nazar started that hashtag a week or so ago, and it's been really eye-opening and touching. And actually, Daniel, the one that I found that was really profound to me was actually one that you tweeted. And your tweet said, those driveway moments when you've dropped off the kids and you have a quiet car to yourself, that's when the sorrow would find me, and the fear and the anguish and the pain. I got the storm and not the calm. And I really, really felt that one, because I feel like those moments, maybe after you were finished dropping the kid off or before you were going inside after work, they were big ones. They were big moments where you were finally alone. And I definitely understood that.
Yeah, one of those moments I actually referred to 2 episodes ago when I talked about Lucas's school bus story. That was one of those alone in the car, and it just hit me hard. Bo, what have you seen?
Mine is kind of along the same lines. This one's from Whitney Lavender, and she says, "My rare disease truth is that I sometimes struggle to put on the mask of pretending things aren't as bad as they really are. But I try to do this as much as possible because I don't want that to be the only thing my kids remember when they look back later on."
Mm-hmm.
Yep.
Yeah, I think I just saw that one today. And my pick, there's so many great ones, but it's just a simple one from Luke Rosen. I saw it said he hasn't gotten more than 4 hours of sleep since diagnosis day. And
wow.
Yeah, I mean, we in our case, I feel so fortunate. There's a lot of things we didn't have going in our favor, but Lucas slept 12 hours a night, and that was a saving grace for us. So all you parents that don't get your sleep, I get it. I can't imagine the added burden that is.
Yeah. And so many of those parents have nurses coming in and out, and sometimes they have to be the nurses because maybe they couldn't make it. And I know parents that don't get sleep for days sometimes.
Yeah. Well, to lighten it up a little bit, I think last time we had Effie do the 2-minute rare disease challenge. So it only seems fair that Bo should do it, right?
Oh my God, he's been practicing. No cheating. No cheating.
No, I haven't.
Do you have a phone handy or a timing device handy?
I don't.
Okay, I'll do the timing for you.
Oh, you okay?
Right.
You thought you'd just dodge it like that, right?
No timer. Can't do it.
So many.
Go.
All right. Howe Fountain syndrome, Menkes disease, CTNNB1, HNRNPH2, Friedreich's ataxia, Engli1, Schaaf-Yang syndrome, Prader-Willi syndrome, Angelman syndrome, Milan syndrome, Schinzel-Gideon, Green 1. I know there's so many. I'm just thinking of people, you think of the people and what are they working on? SSMD, Glut 1. Charcot-Marie Tooth, Sanfilippo syndrome, KIF1A, SYNGAP1, Smith-Kingsmore. Am I out of time?
Nope, you have 30 seconds left.
Right. Lennox-Gastaut syndrome. Let's see. I know tonight I'm going to be like, I'll wake up in the night thinking of one. Man. My mind's a blank.
2, 1, time.
I got nothing. All right.
It's so good.
All right. We'll have to count those up, see if Bo beat Effie. You just mentioned one I never even heard of, though, Schinzel-Gideon syndrome.
Yeah, I was wondering too about that.
Do we know someone, or you must know someone?
I know somebody, yeah, somebody on Combined Brain with me
Nice.
runs that foundation, so.
That's a cool name.
It's a good one. Yeah.
Not so easy to say either.
No.
That was an excellent job.
So, Effie, you found us another great guest to talk to.
Oh my gosh. Okay. Yes, today's guest, she's a pediatrician and a fellow rare mama to an HNRN PH2 kiddo named Rosie. And we invited her to the show to get some professional rare mama doctor input. So welcome to the show, Dr. Nicole Glenn.
Hi, thanks for having me.
We're so happy to have you here and just get your perspective as a rare mama and as someone in the medical field. So thank you so much for being here. We have lots of questions to bombard you with today.
I'm thrilled. Thank you. And I'm so excited to be part of this. I think you guys are all doing fabulous things and just grateful for my little piece of it.
So, Nicole, different people are coming at this, with different personalities, from the patient, parent, and also the doctors. Some of us are more straightforward. Some of us are more shy. And, my question is, how do we maximize our strengths in those appointments? And what questions or things do we need to do to make sure that we accomplish in an appointment to be effective?
I think that's an excellent question. You're 100% right. We all have different styles. Patients have different styles. Doctors have different styles. I think the first thing you can do is kind of check in with yourself and understand the type of patient that you are. So knowing that ahead of time, am I the person who likes more information? Do I like to meet with more doctors? Do I want to keep it simple? I think knowing that about yourself is important. And you can share that with your doc. I do think when I'm talking to patients, I sometimes will give them sort of that feedback, like, hey, I know some families really want as much information as possible and others don't. Where do you find yourself? Do you like a lot of tests, or do you want to do as little as possible? Not all docs will give you that, but personally, I try to do that with my families. I think it helps. And if your doc doesn't do that, you're welcome to give them that information. I think that's helpful. And then I think the second piece of it is then knowing sort of what is your agenda and what are your goals, and figuring out if that is something you can accomplish in one appointment, or is that going to take multiple visits? And are you even talking to the right person to get the answer to the goal that you want? Because I think sometimes we find ourselves realizing, oh, I really should be talking to this other specialist about this, not you. And sometimes you don't know that. And it's better to kind of figure out in the beginning what you need so that you can maximize your time together.
Yeah, thank you. Sometimes I feel like I leave an appointment with just that, like, oh, why didn't I remember that? And I just now learned from another rare mama, Amber Freed, to never leave an appointment with, did I forget to ask any questions that you think I should have asked today? And that's actually came in really handy.
100%. I think writing your questions down ahead of time, knowing what your goals are, is key. I do that even though as a doc, when I'm with my daughter, sometimes I'm just a mom and I have to write it down and remember, what do I want to get out of this? and make sure that we've got that. And then I think the other thing you want to make sure is, so often you leave, and I do this too, thinking, oh, I meant to ask this, or why didn't I think of that in the moment? And I think one of the most important things you can do is to set up communication with that doc when things do come up, because they will. How do I get in touch with you? Do you want me to set up a follow-up? Can I send you emails? Do you have a nurse that I can ask additional questions to? So I think setting that next step will help you when you get home and realize there was something you forgot, or some other thing that you didn't think about that now has come to light, that you have that opportunity to reopen that channel and have that conversation again. And I think that is really key.
You know, Nicole, when I was in the midst of seeing all the specialists and doctors for my son, my wife had a, no joke, portable file cabinet we would bring to every appointment, and it was bright orange. You couldn't miss it, and they saw us coming, you know. And at the time, I was very proud of her and us. I thought we were very organized, and I think it was all necessary. But now, in hindsight, I'm thinking, like, what signals did that send, right? Did that tell doctors, like, these people don't need a lot of help, or these people, you know, are trying to tell me they know more than I do? Or so I wonder, is there something to be examined there about, you know, sort of taking things for granted or subconsciously signaling things rather than just asking for the kind of communication style you want?
I think that's such an interesting question. And I bet people would take it different ways. I think that I would see that as you're organized, you know what's going on, you're on top of it. So maybe then I would think you need less help, but clearly you still need help. You're still there. And I think it just shows that you're prepared. Now, if you try to hand me this giant orange file and say, you know, in the 10 minutes we have, can we go through all of this? That feels overwhelming, but I know you don't do that. So I think sometimes if you do want to pare it down, I actually think it's great to have both. Have that huge file cabinet of all the things you need, so you could get it if you want it, but maybe even having a simple little one pager of, like, these are the highlights. These are the things you need to know right now and are going to be important. And I think by communicating, you know, what your needs are, even if you are completely prepared, we know that you need our help, and that's why you're there. So I think that is okay to do. I think it's good to be prepared.
My wife's a gastroenterologist, and she says sometimes people will come in and overwhelm her with information. And so she likes to say, give me 2 weeks to get my hands on records, and you know, then I can put together this whole picture. And so I'm wondering, you know, we've come in and seen specialists, some of whom are really eager to dive in and find out all about our rare disease, or they've even read the paper about our rare disease already. So do you have any thoughts about sort of, you know, like you said earlier, the follow-up, the communication, you know, sort of managing that relationship and talking about, you know, how much follow-up there's going to be afterwards?
Absolutely. It can take a while to process all that. And I find myself as the kind of doc who really wants to know more, but doesn't always have the opportunity in advance to review all that, especially if patients pop into your schedule and, you know, you don't have that heads up. So I think if you know in advance that you're the kind of patient that probably is going to take more time, especially if you're seeing someone like me, I'm a general pediatrician, so I see everything. I love a heads up. So I sometimes, when I have my complex patients follow up with me, I say, hey, call my nurse, make sure you have extra time because we're going to need it. So I like that. I'm sure not all docs do, but I think that's, again, that's sort of being proactive and making sure you give that doc as much opportunity to do whatever they need to do beforehand. I also like the idea of saying, hey, you know, I know it's going to take time to get to know us, and kind of having that expectation of it's going to take me a few weeks to get through this, and saying, so where do we go from here? You know, what's the next step? I think that not all docs are great about that communication. Some of us are and some of us aren't. And I think that the way you can advocate the best is to make that very clear and say, you know, I know you need time to kind of go through everything. Should I plan to touch base with you if I don't hear from you in this amount of time? And I think that would help so much with all the communication barriers, is just setting that expectation of what's the next step. And that will change with different doctors. Maybe sometimes you're going in just for a quick second opinion. Maybe this is a new pediatrician. Maybe this is a new neurologist that you're going to see over and over and over again. So that relationship is going to change depending on the provider too.
3 impossible things
before breakfast.
I wonder if you can tell us 3 impossible things you do before breakfast every day?
I told Effie, I think I should really give the props for the morning to my husband. And one of those impossible things is probably helping me get out the door and get to clinic on time, because I'm always running late. So making me coffee and making sure that I have my car keys is probably his impossible thing number 1, because I'm always a disaster trying to get out the door on time. Impossible thing number 2, my hubs is usually trying to get my kids up and get them ready for the day. My Rosie is not a fan of having her hair brushed, her teeth brushed, or getting dressed. So that process can take a lot of patience and a lot of singing. We do a lot of singing in our house and distracting, and he's always making up silly jingles to help get her dressed and get her out the door in the mornings. And then the third impossible thing would be getting her fed. Sometimes it's a song for every bite. So we have come very close to requiring G-tube feeds, but we have scraped by with oral. She takes a bottle and is learning how to eat, but every bite is effort, and it can take 45 minutes to get a small amount of food that my 16-month-old eats in 5 minutes into her. So it's a lot of effort, and that's usually his task. So
the singing in our house, before Lucas went to tube feeds, we had to literally do song and dance, and for some reason the amusement must have loosened up his jaw enough that he would actually swallow food. But it was one parent feeding and one parent doing a song and dance routine.
Yeah, I think a lot of us can relate to that, and thank you for your hilarious honesty there. Even just getting these rare kiddos ready and out the door, even with coffee and eggs and bacon in your belly, I mean, it's a huge feat. So I love that story. Nicole, so my question is, who leads our medical complex team? I know rare parents are often surprised that no one doctor kind of takes the lead in their care, and it can be confusing and really frustrating, and we aren't sure which one to really turn to. So who is the quarterback of our team?
Another great question. I think that may depend a lot on your diagnosis. I would like to say it should be me, the pediatrician. It's not always, but I think a lot of times that is who is supposed to be your lead person. I trained at a complex hospital that took care of really, really sick kids with multiple medical problems. And so as a general pediatrician, I sort of expected that. I knew that was going to happen. And we really focused on the concept of the medical home. And the primary care doctor is supposed to be your medical home. But that also means sometimes there are going to be things that I can't do as a general pediatrician. And so my complex families, I try to make sure that they know who they go to for their different things, that they can come to me, but I may have to send them to somebody else because that's just the nature of it. So, I'm not going to be managing cardiac meds. I may not be making detailed nutrition information or nutrition changes on a kid who's got G-tube feeds. But I'm here to help coordinate and make sure that everyone knows. Now, I think in some diseases, I will say, for example, in the oncology world, so maybe for kiddos with rare cancers, they have such a fine-tuned kind of system that sometimes I'm not involved because they have a point person and that doc or that nurse practitioner wants to be contacted for everything. So there are going to be situations where it's not your general pediatrician, so sometimes it'll be the primary specialist that's kind of running the show. There are too, I think not all families have access, unfortunately, to a complex children's hospital really close nearby to them. I'm fortunate being in the Bay Area, I've got that at my fingertips. So there are some hospitals that run complex care programs where they have primary care pediatricians, and that's their job, is to help coordinate with all the different specialists, that these families are dealing with. So you might have that in your community, but if not, then you think being frank with your pediatrician and saying, hey, is this okay? Is this a good role? Are you okay with this role? I think is completely acceptable. I actually had a family who's really not that complex, but do that to me just the other day in clinic. They're a new family, seeing lots of specialists, relatively healthy kid, but mom said, I feel like no one is driving this bus. And she said, who is supposed to drive this bus? And I said, I think it's supposed to be me. And she says, but a lot of docs don't want to do it. And I said, that's why I'm a general pediatrician. That's why I chose this job. Some of my families are going to need me to be a bus driver way more than other families. And it takes time, and I may not be able to get everything done in one appointment, but I'm here for you. And I may not always have the answer, but I'll find it. So, we have that we're building that relationship and that trust. And I know I can't answer every question for her, but at least I can try to send her in the right direction.
Excellent.
That's awesome. Nicole, our family, like I said earlier, my wife's a full-time gastroenterologist. So a lot of the time when somebody's taking our daughter to an appointment, it's me. And so I've just found sometimes when I get to the appointment, they just are not used to the dad being the person. And so I wonder if you have any thoughts on that. I've just felt sort of like sometimes like invisible, or they're like really trying to reach the mom, and I'm there, and I'm like, I'm the guy. Like I know what I need to know to be here. Do you have any thoughts on that?
I think that's so unfortunate that that's your experience, because I think that so many households are a team, and it's not just the mom who's running the show or, running the show for that day, right? Like I have days where my husband has got to take over for things, and things where I'm more in charge. And so I'm bummed for you that that's been your experience. But I think that it's great that you're willing to say, like, no, I got this. You don't have to call mom, I'm here. Because I think that we should be realizing that families come in all shapes and sizes and all sorts of different unique situations. And it's, I think we're going to see more dads clearly. I sometimes get that too in my office. I think I'm used to moms coming in more, and I have some dads that are always the one who come, and I love it. I think they're great. And that's part of what a lot of us went into medicine to do, is we love talking with different people, particularly in pediatrics. That's the best part, is I love meeting grandma and auntie and whoever else comes in the appointment. And so I think you should wear your dad badge proudly and not let anyone make you feel like you have any less right to be there with your kiddo.
We've been talking about quarterbacking a medical team as a metaphor, but there's somebody we know that would treat that metaphor as a literal expression, not just a metaphor. Rob Long was a top college football player being drafted by the NFL, so he really does know the quarterback lifestyle experience, but also now as a rare disease patient, he's going through the same things we're talking about of who can lead a complex team. So I want to welcome Rob and have him talk to us a bit about who he thinks should or does quarterback his team, or should for other people's teams.
So I think this is a really interesting question. And when I think about this, I think less of myself being a quarterback and more of myself being a coach, right? I think there's offense and there's defense. I think on the defensive side, you're thinking of your doctors, my neurosurgeon, my chemo oncologist, radiation oncologist. These are the ones that are trying to defend me from this disease. And I have to work to make sure that, I show up, I have the appointments, the things that I need to do, and then to work to get to a point where we can start to play offense. We can work with a nutritionist and take care of what you eat, how you eat, working with a dietitian and understanding what things we can proactively do to make sure that we maintain this level of health. So I think it's a great question, an interesting premise, and unfortunately so many times it does feel like it falls to the responsibility of the patient to make sure these things happen. And I'm not really sure what the best solution is, right? If you're a patient who's able to handle this, or you have somebody who is a caregiver that's able to handle this, you're much better off, right? But this can be easily very overwhelming for so many people in the rare disease community.
Thanks, Rob. That was, we knew you'd have a particularly precise point of view on this one. So thanks.
Nicole, do you have any stories about super siblings you can share with us?
I do. Rosie has a little brother, so she's our oldest. So her little brother, Jack, is 16 months. So he's still learning a lot. And one of the most amazing things that he's doing right now is, I think he's such a great example for Rosie. My favorite thing is, we bought the kids, or Grandma and Grandpa bought the kids, these little remote control bumper cars for Christmas. But Jack is learning to drive his on his own, which amazes me. It's got like 2 steer. He can back up, he can go forward, he rides it on his own. And obviously we hope that Rosie would learn, and she is learning. She's watching him. She's like trying to put her hands on it so we can control it, but she would love for her to control it herself. She's got a manual wheelchair that she's still really not learning how to push quite yet. So we're hoping this will be a fun thing. And they love to bump and crash. And Jack likes to chase her around. So I think he's going to be a great example. He's going to teach her a lot of things. And we're excited about that.
Nicole, we all know how important it is to try to keep a sense of humor in this rare life. So I wonder, what do you laugh in the face of?
So many things. I agree with you. Humor is a big deal in our household. Kind of thinking back to the singing we were talking about, we are often find ourselves laughing at just the amount of kid songs that run constantly in our house that we have become what we say ear blind to. Rosie loves things over and over again, and one of her favorites is Baby Shark. So every member in my family, every extended member in my family knows how to sing it, knows the words, knows the movement. And we were walking around downtown with her in her stroller with her Baby Shark toy that plays constantly. And we walk around the corner and someone's like, "Do I hear Baby Shark?" And my husband and I look at each other and say, "Oh yeah, that's us." Like all of our local community now hears Baby Shark as we like walk down the street and just like laughing at like, that's our reality. It's Baby Shark 24/7.
That is awesome. Gets in your head.
Rosie also likes to laugh at us. And that's the other one, Effie, I wanted to share. She laughs whenever anyone is coughing. So I do think it's a little bit of like wonderful that she laughs at me, like I'm choking on my water or like something went down the wrong pipe and she thinks it's hilarious. And so as I'm, like turning blue, she thinks it's just, she's got a funny sense of humor. She loves to hear people cough. So that's the other thing we find ourselves doing when we want to make her laugh for photos is we're like coughing, which is pretty great.
Rosie reminds me of someone I know.
Speaking of laughter, I wonder, Nicole, if you'd be good enough to spin our wheel, please.
I'd love to.
All right, you landed on Tess. That'll be a great one. At the end of the show, we'll see Tess laughing. Nicole, can you tell us anything that you either personally wish you knew sooner, or maybe you wish some of your patients knew sooner?
Definitely. I think I wish I knew who to ask for help when I wasn't sure what to do. I think I've learned a little bit the hard way, so even as a doc myself, that sometimes you just don't feel great about the answers you're getting, and who do you go to? How do you navigate that? And so building your team is so important up front, and who is part of your team that's not necessarily a doc? Is it a nurse? Is it a nutritionist? Is it another family who's been through this and can kind of help prepare you for the appointment? So I think knowing that there's more than even just the physician out there for you, I wish I realized that sooner, how helpful case managers are and pharmacists and all the other people. And I think I knew a little bit of that since I have that back, sort of back view, being on the other side. But I think patients really should realize that sooner, that there are so many other people that can help you other than just the doc too. And if you're not getting the answers you need, to try to find them. And then I would also say it's okay to find the right relationship. I think sometimes, even though I have patients that I think love me, I'm sure there's patients that don't love me. And so I think it's okay to find the right doc for you. And if that's such an important relationship, especially if you are going to continue this long-term, if it's not just a one-time consult. So don't be afraid to say, thank you, but I'm going to get another opinion. And that's okay. We should all be okay with that. And most docs really are. And so I feel like patients shouldn't feel stuck.
Thank you so much, Dr. Nicole Glenn, for joining us. And thanks for all of your useful tips and for choosing such a compassionate career. We're so happy to have you on the show. And thank you everyone for watching. Follow us on social media. Let us know if you have any questions. hello@onceuponagene.com. We hope you enjoyed the show. And here's your little pick-me-up from the Wheel of Laughter.